Let me say good morning to all of you and express how honored I am to be here with you today to discuss this critical issue. I want to thank Protect Our Care for the thousands of miles that you have and miles that you will travel and the work that you are doing on the ground to make sure that every person living in this country has access to health care that is affordable. Also want to thank my colleague, Darren Soto. I am honored to serve with him. I am pleased at the work that we have been able to do working together. I also want to acknowledge one of my constituents, Jennifer, who has joined us to tell her amazing story. As you all know, as a nation, we have a lot going on. We have a lot going on domestically, and we have a lot going on around the world. But even with all that we are currently experiencing, I say this today with the utmost confidence that we are the greatest nation in the world. But I also want to say, though, that membership then should have its privileges. Jim Clyburn, another amazing colleague, likes to say this, and I think it really frames our conversation here today and puts the work that we are trying to do into perspective. Our majority whip says that we don't need to make America great again. America is great. It always has been great. That is not the challenge. But the challenge to me is how do we make the greatness of America accessible and affordable for all Americans? I thank Jim for those words. Look, I don't particularly care what position you're in or what party you're in. Our number one responsibility as elected officials, as true leaders, number one, is the health, safety, and well-being of the people that we represent, the health of families, the health of our seniors, the safety and well-being of people. And we should never make that political. But unfortunately, and we know the last year and a half has really, I think, put a bright light on the injustices in health care in this country that is the greatest country. As we deal with the unbelievable number of deaths around our nation and around our state, we should never make our response to any crisis, and certainly not a public health pandemic, political. Every American, regardless of who they are, the color of their skin, where they live, or how much money they have, should have access to quality health care, should have access to health care that is affordable. We have ways that we can do that, and my colleague highlighted some of them earlier. We can allow Medicare to negotiate the cost of prescription drugs. We can expand Medicaid. If we know that expanding Medicaid not only provides coverage, but also provides financial stability, why wouldn't we want to do that? And Florida, shamefully, is one of 12 states, only 12, but 12 too many, that have refused to expand Medicaid to provide coverage to those without it in a country that we say is the greatest country in the world. In terms of Medicare, why wouldn't we include vision care and dental care? Why wouldn't we include care for hearing to not only improve the overall health of our seniors, but to improve their quality of life? Ladies and gentlemen, we are living in some critical times, and we are facing some critical issues. But I think it's fully unacceptable that we in America pay more for prescription drugs, for example, than any other country, that we here in America pay 3 times more than any other person in another country. If we are who we say we are as a nation, then we have to live up to America's promise and do what the majority whip says our marching orders are. Let's make health care accessible and affordable for every American. Thank you all.